Have you ever wondered whether your home blood pressure monitor is actually accurate? Many people check their blood pressure every day, see the number on the screen, and immediately start to worry. But the truth that few people talk about is this: measurement errors at home happen very often. Just one small mistake can cause the reading to be off by 10 points or even more. This makes many people believe their blood pressure is dangerously high, when in reality it might not be. And those incorrect numbers can sometimes lead people to worry unnecessarily or even change their medication when it isn't needed. So in this video, we're going to explore something very important: how to know whether your home blood pressure monitor is truly reliable. By understanding just a few simple principles, you can avoid a lot of unnecessary stress and confusion. Before you conclude that your blood pressure monitor is inaccurate, there is something very important many people don't realize. There are 3 factors you should check before every measurement. If these 3 things aren't correct, the number on the screen can be off by 10 points or even more, even though the device itself is working perfectly fine. The first factor is the type of monitor you are using. Experts generally recommend an upper arm blood pressure monitor because this position is closer to the heart and the larger arteries, which helps produce more stable and accurate readings. In contrast, monitors that measure blood pressure at the wrist or finger are much more sensitive to arm position and often produce less reliable results. The second factor is the cuff size. This is a very common mistake. If the cuff is too small, the reading may appear falsely high. On the other hand, if the cuff is too large, the reading can be lower than the actual value. A proper cuff should cover about 80% of the upper arm and be snug enough that only 2 fingers can slide underneath. The third factor, often the most overlooked, is your posture during the measurement. Simply sitting incorrectly, talking, or using your phone while measuring can raise your blood pressure by several points without you even realizing it. One very common mistake many people make when measuring blood pressure at home is not paying attention to the time of day they take the measurement. Blood pressure is not constant. It changes throughout the day depending on activity, emotions, and timing. For example, if you measure it right after waking up, after drinking coffee, after exercising, or when you're feeling stressed, the number can be much higher than normal. This often causes people to panic when they see a high reading, even though it may simply be a temporary change in the body. Experts recommend measuring blood pressure in the morning about 20 minutes after waking up, and again in the evening before going to bed, after sitting quietly for at least 5 minutes. When measuring, it's best to take 2 readings 1 minute apart and use the lower number. If you'd like me to share how to check whether your home blood pressure monitor is truly accurate, comment 1 below. Another important factor that greatly affects the accuracy of home blood pressure readings is body posture. Many people measure their blood pressure while talking, checking their phone, or sitting in an improper position without realizing that these habits can significantly raise the result. Simply slouching, crossing your legs, or leaving your arm unsupported can increase the reading by 5 to 10 points. For a more accurate measurement, you should sit on a chair with your back comfortably supported and keep both feet flat on the floor without crossing your legs. Your arm should rest on a table so that the cuff is positioned at the same level as your heart. Before measuring, sit quietly and relax for at least 5 minutes without talking or using your phone. By making these small adjustments, the blood pressure numbers you get will become much more reliable and meaningful. After choosing the right type of monitor, using the correct cuff size, and sitting in the proper position, the next very important step, one that many people often overlook, is measuring your blood pressure more than once. Many people take just one reading, see a slightly high number, and immediately become worried. But in reality, blood pressure can naturally fluctuate from minute to minute.
That's why experts recommend that each time you measure your blood pressure at home, you should take 2 readings, about 1 minute apart. Then record the lower of the 2 results. This helps reduce small variations that can happen if your body just moved, your posture changed, or if you felt a little nervous when starting the measurement. In addition, it's helpful to write down your readings in a notebook or on your phone so you can track them over time. When you have more data, you'll understand your blood pressure much better instead of relying on just a single number. One very important step that many people often overlook is checking the accuracy of your home blood pressure monitor. The simplest way is to bring your device with you when visiting a clinic or during a routine doctor's appointment. Sit quietly for about 5 minutes, then measure your blood pressure twice using your own monitor and write down the results. After that, a healthcare professional can measure your blood pressure again using a manual method on the same arm. If the difference is within about 5 to 10 points, your monitor is generally considered reasonably accurate. It's a good idea to check this about every 6 months. If you'd like to learn more about common mistakes people make when measuring blood pressure at home, comment 1 below.
One final important point that many older adults often overlook is the time of day when they measure their blood pressure. Blood pressure does not stay the same throughout the day. In the morning after waking up, it often rises slightly as a natural response, while in the evening it may drop a little as the body relaxes. For this reason, experts usually recommend measuring your blood pressure at the same times every day, such as in the morning after waking up and in the evening before going to bed. Doing this helps you track the true pattern and trend of your blood pressure, rather than relying on a random reading taken at any time during the day. By maintaining a routine of measuring at the same time, recording the results, and comparing them over time, you will gain a much clearer understanding of your health. Sometimes even a small change in measuring habits can help detect early warning signs of abnormal blood pressure. High blood pressure is not just a number on the monitor, it's about building a daily habit of tracking your health. With just a few small changes, such as measuring in the correct position, taking 2 readings, recording the results, and measuring at the same time each day, you can gain a much clearer understanding of your blood pressure. The key is consistency and checking your monitor regularly to avoid inaccurate readings. If you or a loved one measure blood pressure at home, applying these simple steps can make the results much more reliable. If you'd like to learn about other common mistakes people make, comment 1 below.